Hello everyone. So we are again here with Dr. Preeti to discuss the changes in your pregnancy that happen week by week, and today is 25 to 28 weeks of your gestation. So Dr. Preeti, what are the changes that baby undergoes during this time period?
The significant changes happening in the baby during this time is that there is development of the subcutaneous fat, which acts as a thermal cover over the baby. Also, the hair on the skin start becoming long and lustrous. Another important development in the baby is that the lungs start producing surfactant. Surfactant is an element which is important for the development of the lungs. The eyelids, surprisingly, at this stage open. Baby gains weight, and the weight around this period is more than a kg now.
Okay.
As
So mother is also simultaneously undergoing changes and her weight is increasing since the baby's weight is increasing, leading to abdominal distension, stretching of skin, even itching. And because of excess weight, we see a lot of other signs and symptoms that develop. So can you enumerate some of those?
So yes, first last 2 months would have been a little comfortable phase for the female, but now the pelvic muscles they start becoming lax. Also, the ligaments around the pelvic bones they become lax, which leads to some kind of a stretching pain in the midline of the of the pelvic bone. Some patients also experience increase in back pain. Also, there can be pain in legs, especially at night. All these symptoms, if you experience, are exaggerated, then you need to report to your doctor. Few patients will complain that there is swelling in feet and swelling in hand, and there is a tingling sensation in hands also. Again, this is all because of accumulation of some amount of fluid. Apart from that, since the baby is now developing and growing and it starts putting pressure on other organs, the other abdominal organs of the female, also on blood vessels in females, which increases the chances of female to have constipation and hemorrhoids. In that case, if you see any kind of passage of blood through stool or blood stained stool, then you need to report it again to your doctor. Also, the
So
height of the uterus increases. It is now above the umbilicus. That significant change you will see in your body during this period.
So, Dr. Preeti, are there some any important tests or vaccinations that can be taken during this time?
During this period, between the 24 to 28 weeks, a very important test, which is called the GCT for the diagnosis of gestational diabetes, is done. Also, at 28 weeks, your doctor will advise you to take a vaccine, a triple vaccine called Boostix, which is very essential for yourself and for your baby. Also, there can be additional tests at this period of time according to any other complications or any other problems in your previous test. Your doctor might advise a simple CBC also at this stage. So, this is the stage when your second trimester has ended at about 27 weeks, and you will be in the third or in the final trimester of your pregnancy. It's a very important phase when your baby will rapidly start growing after this in weight.
So thank you so much, Dr. Preeti, for highlighting the important changes that are happening, the start of the third trimester, and the most important phase of woman's cycle. And this will determine that how you are going to be, what will be with the baby weight. You can also plan your mode of delivery. Although the lie is not constant at this time, it will keep changing as the baby grows. But head down position usually comes for lot of women during this time because that is the most common presentation for the baby. If you want to know more about Boostrix, you can also go and watch our video which is on immunization in pregnancy on YouTube or on Facebook. You will get to know more about this vaccine and not to miss the GCT test as told by Dr. Preeti. This is a very important screening test for gestational diabetes during this time period. So thank you for patient listening and see you next time.
Thank you, everyone.